bad enough I have to do this, and now I have to do it in front of a big screen of me in front of me. So, wow, okay. You can see all my tics and mannerisms right in front of me here. So we're good? Okay. Well, good afternoon, everyone, and thank you very much for joining us. Participating in the briefing today, of course, is Dr. Morrison. We're being joined virtually by the Minister of Education and Lifelong Learning, the Honourable Natalie Jameson, as well as Norbert Carpenter from the Public Schools Branch, and Gilles Arsenault from the CLSF, who will be online to answer any questions relating to the operations side of our education system. As we have throughout the pandemic, we continue to use the best and most up-to-date health data to inform our decisions. And based on the level of concern with the trends of COVID-19 in the province, Dr. Morrison and the CPHO team have made the recommendation to government that we extend the current health measures we have in place till at least January the 24th, and Provincial Cabinet accepted that recommendation this morning. That includes the continuation of online learning for island students and teachers. Moving forward, Dr. Morrison has further recommended that we will continue to assess this situation on a weekly basis with a decision each Thursday with the desire to lift the measures as soon as it can be deemed safe to do so. The weekly assessment process, as it has throughout our weeks in dealing with the Omicron variant, looks at a number of trends connected to COVID-19 in our province, including the 7-day average of positive cases, the percent positivity rate, the number of hospitalizations and the severity of those hospitalizations, and the impacts that that number might have on the overall delivery of our healthcare system in PEI, as well as the continued vaccine uptake in the province, including booster shots for those who are eligible, and for the vaccinations for our 5 to 11-year-olds. As complicated as this can be, I'm sorry that there isn't just a simple, we need to get to X here or Y there. It's more of an overall combination of these trends and their impacts within our borders, and Dr. Morrison will do her best to explain that in a little greater detail here momentarily. This is one of the most challenging and most contentious points of the pandemic for our education system. We're trying with all of our might to reopen, but we know in-person classes, because we know that in-person classes are what's best for our students. When we open, we want to do everything we can to stay open, because we know the starts and stops are even more challenging and troubling for students, teachers, families, and staff. For weeks now, we've been working on doing everything we can to operationalize our back to school, knowing that this is going to be a tremendous challenge for all of us. The department, the Public Schools Branch, and the CLSF are working hard to ensure that there are as many contingency plans in place as possible to ensure, to the best extent we can, that when we reopen, we can stay open. We know and are preparing as best we can for the reality that because there are extensive cases within our community, that when our school opens, there will be cases in our schools, and that will lead to challenges and disruptions. And we will do everything we can to prevent as many of those disruptions as possible with our regular at-home testing, our masking, our cohorting, the installation of HEPA filters, the social distancing, but we know there are going to be challenges. We know our students need to be in school, and we know that online learning isn't ideal. We know from the general reports that it has been going better this time than before, but we know that our students, teachers, and families need to be in school. And we also know that there are many within our province that need access to additional services. Then the department has been working to add additional staff to assist students, and Minister Jameson will be providing a much more thorough update on that and other measures in a moment. We do want to acknowledge the understanding that this is a stressful time for families. We know that by taking a community approach and helping Islanders access the resources we have in PEI and in other jurisdictions will be helpful. To that end, we're actively working with the community through the PEI Alliance for Mental Well-Being at this time to help us identify accessible tools that families can tap into today. And these tools and resources will be shared on social media and on our website later today. And just before I do turn it over to Dr. Morrison, this is obviously not the news that we were all hoping to deliver today, nor do I want to be out here, do we want to be out here again today asking you, all Islanders, to dig in a little deeper, to go a little harder to get us through this last leg. I know how deep you have dug, I know how hard you have pushed, and I know the toil it is having on you, your families, your communities, and our province. I feel it too. Dr. Morrison feels it. We all feel it. And I just wanted to share this thought that, over the holidays, like many of you with not much else to do, I spent a little time on Netflix, and I was watching a series about World War II and was struck in particular by the point in time near the end of the war where Prime Minister Churchill, after almost 6 years of asking citizens of Britain to do anything and everything for the cause, and having citizens respond each and every time with overwhelming support, that the hardest thing he had to do was that last little ask and that last little push for just a little bit more. I don't want anyone to think that I think this is like World War II or that I'm like Churchill. It isn't, and I'm not. But I think some of the realities have some similarities here. I know you're tired of this. I know you feel like you've done all you can. I know you feel like you're done with it all. But we do have to ask you to push just a little bit harder. You have to get out and get your booster. You have to get your kids vaccinated. Keep your circle tighter for just a little bit longer. Follow the public health protocols that we have in place. Do what we have been doing from the very beginning. Think not just of you or your family or your friends. Think of your neighbors, your community, and your province. I think the only way we can explain this is we're running a marathon here. We can see the finish line. We're tired of running. We've been at it for a long time. And the hardest steps are these last ones we have to make. But we have to continue to make them and take them one step at a time. We're getting there. We're almost there. We just need that little extra push. So thank you to all Islanders for doing what they're doing, and I know that you will respond because you always have. So with that, I'll turn it over to Dr. Morrison.
Thank you. Thank you, Premier. You have a great way of putting that, what we've been trying to do over such a long period of time. I'll do a little update on the situation here and the status of the outbreaks, and I'll speak about extending the current measures that we have in place. As of 8 o'clock this morning, there are 209 new cases of COVID-19 to report, bringing our total active cases to 1,964 and 3,636 since the pandemic began. Over the last 7 days, we've had an average of 192 cases per day. There are 8 people in hospital with COVID-19, including 1 person in intensive care. And I would note that New Brunswick announced yesterday 94 individuals with COVID in their hospitals, and Nova Scotia announced 60 cases in their hospitals. We are all experiencing firsthand how easily and quickly Omicron variant spreads. With a shorter incubation period, each Omicron case infects 4.5 times more people than each case of the Delta variant. Reinfection is more common, meaning that individuals who had previous strains of COVID are also getting reinfected with Omicron. In terms of outbreaks, earlier in the week, we shared information on a number of them, and as an update today, there is a new outbreak at the Atlantic Baptist Long-Term Care Facility. 4 residents and 3 staff have tested positive, and further testing is taking place today. Garden Home Long-Term Care Facility, there are now 13 residents who are positive and 3 staff. At the Provincial Correctional Facility, there's a total now of 7 staff who do have COVID and 3 offenders, and 1 additional offender who is not linked to the outbreak, who also is positive. In the child care centers, there are 11 early learning child care centers with either cases or clusters of cases. 4 of these facilities are open, 4 are closed, and 3 are open, offering modified or limited services. Miscouche Villa Community Care Facility, no new cases to report, and the next round of testing will take place tomorrow, January 14th. The outbreak in a population that regularly access shelters and outreach services in Charlottetown, there are now 7 cases in this population, so 2 new ones since yesterday. In addition, there are numerous other outbreaks in workplaces across the province. Given the increase of new daily cases and the current active case count, the number of outbreaks is not a surprise. It is also not a surprise that Omicron is seeking out individuals who are vulnerable and in higher risk settings. We believe it'll be another 2 weeks before we see the worst of this wave. But while we are taking steps to decrease the slope of this curve and flatten the peak, we cannot predict how high the peak of this wave will be. Our current situation is not one that we would choose for ourselves. It is characterized by a great deal of uncertainty and unpredictability. The reality is we have a high volume of daily cases and active cases, and numerous outbreaks throughout the province. We have widespread community transmission, with just over half of children aged 5 to 11 years vaccinated with 1 dose, and less than 50% of eligible adults over the age of 50 years with their 3rd dose, coupled with a well-prepared but strained health system. We are seeing unprecedented spread within the province, and we are at an important juncture of this wave. We will know much more about the impact of Omicron on our province, including the health and well-being of Islanders and associated impacts on our health system within the next 1 to 2 weeks. It is important that we continue to base decisions on the evolving epidemiology of the Omicron variant. We have benefited from taking a cautious and steady approach throughout this pandemic, and now is not the time to change that course. We're often asked about vaccination, and in light of Omicron variant. 2 doses of vaccine provide some protection against hospitalization and severe illness, and a booster or 3rd dose results in better protection. Being vaccinated, including getting your booster when you are eligible, is our best protection against Omicron. In Canada, 46% of hospitalized cases with Omicron have been fully vaccinated, and 54% are unvaccinated. Given the vast majority of Canadians are fully vaccinated, hospitalizations related to this variant are disproportionately in individuals who are not fully vaccinated. People who are not vaccinated are at higher risk of severe outcomes related to COVID-19. Regarding the people hospitalized for COVID-19 in PEI, out of the 7 individuals until yesterday, 64% were fully vaccinated and 36% were unvaccinated. So 7 and 4. Now, again, in hospitalizations related to COVID are disproportionately in individuals who are not fully vaccinated, because we know we have the majority of our population vaccinated at this point in time. While COVID-19 vaccines are effective, a percentage of people who are vaccinated will become infected with the virus. As more people are vaccinated, we expect that more of the cases and hospitalizations will be in those who are vaccinated. We also know that vaccine effectiveness wanes over time and that new variants also impact the effectiveness of vaccines. As of Wednesday, January 12th, 95.9% of Island residents over the age of 12 have received at least 1 dose of vaccine, and 92.6% were fully vaccinated. 56.1% of children aged 5 to 11 have had 1 dose, and over 34,000 individuals have had their 3rd dose or booster dose. As of today, 21,000 people are eligible to receive a booster that have not yet done so. Approximately half of these individuals are over the age of 50. It is important that everyone over the age of 50 should place a priority on getting his or her booster. And that's because the evidence shows the outcomes are more severe in that age group. There are thousands of vaccine appointments available this month, and we will make progress on giving booster doses and immunizing children aged 5 to 11. In terms of boosters, we will be able to vaccinate up to 50,000 eligible Islanders aged 12 and over. There are appointments available this month to allow us to meet the target of having 90% of children aged 5 to 11 vaccinated with at least one dose. And it's also exciting to know that beginning next week, some 5 to 11-year-olds will be eligible to receive their second dose, as it will be 8-week interval from their first dose. As the Premier mentioned, we have met with Cabinet, and they've accepted the recommendation to extend the current public health measures that are in place until January 17th until January 24th, with a further assessment next week. And I may not read all of them, but it's a reminder that these measures that are in place include our personal gatherings limited to 10 people, and these people should be steady and consistent group of 10, and a smaller circle is better. Wedding receptions and funeral receptions are not permitted. All organized gatherings, including worship services, must operate with a maximum of 50 people with physical distancing between households. Multiple cohorts are not permitted. Gyms, fitness facilities, and retail can continue to operate up to 50% capacity with physical distancing and masks. And visitation to long-term care and community care is limited to 3 partners in care with physical distancing. And when homes and facilities have outbreaks, visiting is further restricted. Physical distancing is required in all venues up to a maximum of 50% capacity in retail businesses and VaxPass events, including theaters, gyms, etc. Restaurants and eating establishments must maintain 6 feet distance between tables with proof of vaccine for all patrons and masking at all times except when eating or drinking. Food premises and eating establishments must stop food and beverage services at 11 p.m. and close by midnight. No dancing at events, and indoor sport and recreational activities continue to be paused for island children, including organized sports, tournaments, competitions, games, team training, and practices. Whenever possible, employers should support employees working from home. As the Premier mentioned, I've also recommended that school reopening for in-class learning be delayed until January 24th for all public and private schools based on a further assessment next week. The decision to continue online learning and delay students returning to school was a very difficult one. We know the very best place for children to learn is in school. We know that school is important for social, emotional, and physical development. We know school is a place of safety and solace for many students. In balancing the importance of in-class learning with the safety of students with our current reality with COVID-19, we are most comfortable with the recommendation to delay school reopening for 1 more week. Based on what we know today, I believe this is the best decision for our island children, families, and staff in schools across this province at this time. I will note that we have layers of protection ready for when school opens, and that includes masking, cohorting, and 125,000 tests in 5 packs have been delivered to every school across the province for distribution from those schools, and that's for K-12 as well as private schools. The next week will allow more children aged 5 to 11 to be vaccinated. There are many vaccine appointments available for children, and I urge parents and guardians to schedule appointments to have their children immunized. Over the coming days, as the Premier mentioned, we'll be finalizing outbreak response guidance for the education system, and we've asked the education authorities to, and they've already done so, identify outbreak response individuals and teams to help manage cases and outbreaks that will occur in schools. We know that despite our best efforts and preparations, there will be cases of COVID-19 in the schools. In partnership with education, we will be able to respond to manage these situations. Our aim will be to minimize disruption in learning for students and for PEI families in general. Given there are 2 outbreaks at long-term care facilities and 1 at a community care facility, we've had to modify the visitation guidelines. 3 partner in care visits, or 3 partners in cares, individuals can visit their loved ones in long-term care and community care. Residents are not permitted to go on community visits unless it is for essential purposes such as medical or dental services. In facilities where there's an outbreak, only 1 partner in care is allowed to visit. These measures are in place for now, and we hope it will not be for long. Just to also mention, staff in long-term care, regardless of their vaccine status, are tested multiple times each week using rapid antigen screening tests. We've been asked, when will we know when things are getting better and when children can return to school? And this is a good question, and it's the same question we've been trying to answer for a long time. When is the pandemic over? And we've discussed it at length, and we look at all the information we have. And it is difficult to put definite specific indicators and metrics in the light of this Omicron variant. But we will be looking at trends in key areas that would indicate a degree of stability in our COVID-19 situation, such as a stable or decreasing number of hospital admissions, and including the demand on ICU resources. A stable or a decreasing number of new cases, stability in the number of new institutional outbreaks affecting vulnerable individuals, and importantly, the number of boosters also that have been administered, especially in the over 50 age group. And the number of children aged 5 to 11 who are immunized is also something we're monitoring daily. We cannot stop the Omicron variant among the population, and we've said before, we want to try to slow it down. School environments are no different. When in-class learning resumes, there will be cases and outbreaks of COVID-19 in school settings. Our public health system is under stress as we manage the surge in new cases and outbreaks in high-risk settings. Our colleagues in health PEI and in the private sector are also being challenged to meet the needs of islanders at testing clinics, vaccine clinics, and in program and service areas from one end of the province to the other. And the Premier mentioned this, we ask for your continued patience, and everyone is working very hard. We all are. And this impacts each and every one of us. And it is not the information we want to be sharing this afternoon. And we have been fortunate to have avoided significant outbreaks in high-risk settings in the first 21 months of this global pandemic. And Omicron is proving to be much more challenging to manage, and many ways is a totally new phase of the pandemic. We've talked about it before, how discouraging and disheartening at this stage of the pandemic it is that it is spreading so quickly in our province and affecting so many families and disrupting lives. And we are, at the same time, grateful for the measures that we have in place to try to mitigate and fight back against the variant. I know I mentioned last time, and as the Premier mentioned, there'll be information on the website about programs that provide financial supports as well to people who are affected by COVID-19. And most importantly, residents of PEI have demonstrated their resilience and willingness to buckle down and do what needs to be done in terms of this pandemic. My youngest son, or one of my children, said to me last night, one of the boys said, you know, what do we mean by when we get to endemic? And why is it different than pandemic? And before I had a chance to respond, he said, maybe it's endemic means it's the end of the panic that is part of the pandemic. And I said, well, that's part of it. I think we will get to a place where this is endemic and we're testing people differently and we're managing this differently. But right now, this is what we're faced with, and we're going to do our best to protect islanders and our healthcare system as best we can. And I do see this as a tunnel, and that is more behind us than ahead of us. And we will get through this one step at a time. And as the Premier said, it is some days it really feels like one literal step at a time, as we all do what we need to do to protect ourselves and others. And as we go through this one step at a time, we'll have to continue to be patient and continue to be kind. So thank you.
Well, thank you, Dr. Morrison. Wise words from your son. That's we can all be so hopeful. We'll now turn it over to Minister Jameson, who joins us virtually here, and she can give us an update on how things are looking from an educational perspective and talk about some of those operations, what we're working on, and as well some of the programs that we're looking to enhance in the days ahead. So over to you, Minister.
Thank you, Dr. Morrison, and thank you, Premier King, and hello to all those tuned in today. As much as we'd all love to be moving back into the classrooms on Monday, we know that the recommendation from Dr. Morrison to continue with remote learning until at least January 24th is in the best interest of our students, our families, our staff, and our communities. Our teachers have done an outstanding job pivoting to the online platforms. Remote learning is going very well, and we thank them for that. I know learning from home can be challenging. I commend our students for their resilience and the parents and guardians who are providing support. We know that remote learning would not be possible without you, so thank you. Every family is very different, and for many, the current situation is not ideal. I want all families to know that we have established a $125 weekly childcare allowance. These funds can be used to help pay for a private babysitter or go toward fees at a licensed childcare center. The application to support private childcare is a simple online form on our website. Or if your school-age child is at a licensed center, we will automatically provide the funds to the center to help pay for your child's fees. No application is required. We currently have around 300 families receiving the allowance. Our aim is to be as flexible as possible. Basically, if you need to hire a babysitter or pay for childcare because schools are closed, we will help pay for it. If your family is struggling to find childcare, please reach out. We have staff who will work with you to identify services in or near your community. We have a registration form on our website, or you can call our office directly. For families with children who have special needs, those are children who are followed by an educational assistant or a youth service worker at school. We will further expanding our respite program in both the English and French school systems. Many of the schools will move to a full-day respite program for these students. There are email addresses on our website where parents can register for the program, or if you haven't already done so. We currently have about 340 students we are providing respite care for across the province. We recognize that students have been away from school for a long time, and that in and of itself can be challenging. Starting next week, we will be providing a school-based support program. There will be limited capacity based on CPHO recommendations, but it is for any family or child who is struggling. Perhaps the student is not coping well with remote learning, or they could be struggling academically, or their home situation perhaps is just not ideal. We will have substitute teachers at schools helping students with the remote learning plans provided by their classroom teachers. Student services and school staff will be identifying students they feel would benefit from this type of support. And if a parent or guardian feels this is something that their child would benefit from, they can reach out to their school administrators to sign up. This is a new initiative, and we hope to serve as many families as we possibly can. Right now, our Apse supports for blind and visually impaired students, as well as our occupational therapists, our speech language pathologists, and our school counselors are reaching out to families. These professionals are working one-on-one with students, both virtually and in person. This work will continue to expand. Additionally, the school food program will continue. This is an exceptional program, and I encourage anyone who needs food support to sign up. The COVID-19 vaccination clinics have increased the number of pediatric vaccination appointments available for children ages 5 to 11 across the province. They've also expanded the pharmacy program to include those ages 12 and above. I encourage all Islanders to take the steps to get their children vaccinated as soon as possible. I also want to provide a quick update on the early years sector. The staff and educators in our early learning and childcare centers are amazing, and they really have done throughout this entire pandemic. So from the bottom of my heart, thank you for all that you do. Last night, our department, as well as the Chief Public Health Office, met with the early years sector to go over the added measures being put in place to help protect our youngest Islanders. As a province, we are providing additional testing supports for centers as well as masks. We provide financial supports to cover parent fees if centers are forced to close because of COVID. And we also have the allowance for families, which I mentioned earlier. There are a wide range of support programs to the Department of Economic Growth, Tourism and Culture. I will highlight just one that may be beneficial for many families. It is the COVID-19 Special Leave Fund. One of the eligible funding streams is for because they need to care for their children when schools or regular childcare are closed due to COVID-19. All the details and requirements are online. I want to thank our educational authorities for their continued collaboration. I know Norbert Carpenter and Jill Arsenault are on the line with us today, and they've been working around the clock. So thank you both, and thank you to all your staff. We are all working hard to provide for students and staff during this time of remote learning, but I can also say with confidence that the education system is also working to be ready for the COVID realities we will face once in-class learning resumes. Contingency plans are being revised for when we can safely reopen our schools. Staff have done call outs to all of our substitutes to ensure our lists are up to date. And I encourage any Islanders who have the credentials or an interest in being a school substitute to please reach out to the PSP or CSLF. 95% of our educational staff are fully vaccinated. We have the new HEPA filters being installed, and all of our schools have received their shipments of triple layer masks and rapid antigen test kits for students and staff. Another question that comes up a lot has been around our high school exams. With the decision to continue with remote learning until at least the 24th, high school examinations will not be held this term. Marks need to accurately reflect what the student knows and can do. Asking students to complete a high stakes assessment remotely when the majority of their instruction and assessment has been in person would be inappropriate and unfair to students. So we have decided that for first semester, students' final marks will be based on their class-based assessments, including those completed during remote learning. I know some families are getting tired. Please know that we are here for you and that these decisions to continue at home learning are certainly not taken lightly. Finally, when it comes to online learning, to all the parents and guardians, hear me when I say, simply do your very best. Peace in your home is more important than perfect schoolwork. Reach out when you need support. We are here to help. In closing, we will get through this. There are better days ahead. Thank you again for your patience and your perseverance. I'll hand it back to you, Premier.
Thank you very much, Minister. And just before we go to questions from our friends in the media, I would just again want to make sure that you and your department are fully thanked for the work that you have been undertaking here over these last couple of weeks. I know the days have been long, but under your leadership and under your direction and with so many great partners, it's been amazing what we've been able to pull together, and it will take that effort and more once we get back into school to get everybody through this. So thanks very much for that. So with that, I'll turn it over to questions from our friends in the media, some online, some in person, and maybe we'll start with Cody from CBC today.
From the Guardian.
Guardian,
actually.
sorry, Cody, sorry.
No worries. Dr. Morrison, what are we doing wrong on PEI to see these cases continue to rise daily?
Hi, Cody.
Hi.
So I actually think we're doing a lot of things well. And I think what we haven't seen in here in PEI are the doubling of cases that you've seen in other places that the cases are doubling every 2 to 3 days. So they're definitely higher than we would want, but we haven't seen the the rapid increase in the cases. So I think that's a lot in due to the measures and the response of Islanders to these measures. So I think I said last time, I think it's important that we continue to follow these measures a bit longer, trying to do them really well, making sure that whether they're the personal public health related measures, personal measures, or broader public health measures in terms of organized gatherings, but also not going to work when you're ill and wearing your mask when you're supposed to and how you're supposed to. So I mean, I'm concerned about these outbreaks in vulnerable settings, and I'm concerned about the potential impact that could have with these additional cases on our healthcare system. And we need our healthcare system to be there if we get sick with COVID, but we need it also to be there for all sorts of other reasons. And we need it to be there for our families if they need it. And throughout the pandemic, that has been one of the real goals of the measures that are put in place. So I think if we continue to do all these measures that we know will make a difference in terms of slowing down Omicron, because it is different than we've seen in other waves. I'm hoping that we won't have that escalating peak which overwhelms our healthcare system capacity and impacts even more people in the province.
I would love to follow up on that question, but we only have 3 and there's so much happening today. In terms of schools, this is for anyone, what do we need to see happen for students to end up back in class?
Well, I think we've tried to outline that today, both Dr. Morrison and I. I mean, it's not a simple equation, but it's a collection of trends that we're trying to monitor. And Dr. Morrison talked about it a lot more in-depthly than certainly I did or could or should. But it's essentially looking at the case counts, the case positivity rates, the hospitalizations, the severity of the hospitalizations and ICUs and impacts that it has on our society and the vaccination rates. And it's a combination of all of those trends, I think, that go into the, I think I referred to it last night in a meeting as a complicated recipe for a cake that if your mom and dad cooks at home using an old recipe, there's not really a recipe that says 1 cup of this or 1 cup of that, but they seem to know what goes into it. And that's kind of the way I tried to explain it for myself to Dr. Cameron and to Dr. Morrison so that I could understand it from just strictly at my level. And that's kind of what it's like, I think. But maybe Dr. Morrison could...
I think you summarized it well. And I mean, I think that's when we were talking about, when we know things are getting better and how challenging that is. So we look at trends. So if there's a stable and a decreasing trend in terms of the rates of new cases, a 7-day average of those, our percentage of unlinked cases in terms of trends, our 7-day test positivity, a trend in that, our stable number of new outbreaks especially in terms of institutional outbreaks, our daily rate of hospitalizations, again, 7-day average of those, and in terms of no change in the trend or improving trend, and of course wanting to also have vaccination rates for the 5 to 11-year-olds and booster rates, especially those are 50 years of age and older, who are most at risk of having severe outcomes and ending up in hospital. So it's all of those different metrics and trends, and but also we look at those internally, but we're also paying attention because it impacts us here in PEI from a healthcare system capacity if the hospitals are also being overwhelmed with COVID in our neighboring provinces, which are referral locations as well. So having 94 hospitalizations in New Brunswick, that can also impact us here if we needed certain care. And I mean, I don't know, the Premier may want to speak to that as well, but...
I think that I've probably said enough.
Yeah.
Sure. And so with schools still being closed, I'm wondering, what is the plan for daycares as we have 11 early child care centers who have outbreaks right now? If you're talking about worrying about the effects that might have on our health system, why are we still keeping daycares open? And if we are, what is the plan for them?
Well, I think Minister Jameson, you may want to add to that as well, and I think you referenced some of it. I mean, daycares are certainly in smaller numbers in terms of how many students or not students, but children are at daycares, and they're considered an essential service. We have people breaking down testing packs, and we've delivering test kits for staff, as well as children at the daycares and the early learning centers across the province. Those are going to be sent out, and they're being broken down now into packages for the different centers, as well as masking. Minister Jameson spoke about meeting with them. We've sent out updated outbreak guidance for them, but recognizing that some of them are cases and clusters, some of them aren't necessarily outbreaks, but they have huge impacts on those centers and also on those families involved. So the early learning centers have been operating really throughout the pandemic, and speaks to how much they're needed, certainly. And there have been many essential services that have continued to operate in person because they're needed to throughout the pandemic.
Excellent. Thank you.
Thank you, Cody. Julianne, bonjour.
Bonjour, good afternoon to you both. Dr Morrison en français, s'il vous plaît. Pourquoi avez-vous décidé de reporter le retour à l'école en personne d'une semaine? Qu'est-ce que vous avez pris en compte pour dire non, lundi, les enfants ne retourneront pas à l'école?
On a pris la décision, Julien, c'était pas facile. On sait bien que les enfants qui sont dans la classe, c'est meilleur. C'est la préférence d'être avec les autres étudiants en personne. Mais on voit le nombre de cas qui est en train d'augmenter, le nombre de outbreaks vraiment dans les soins de foyers de longue durée, au daycare, et alors ça nous inquiète. Et on voit les personnes à l'hôpital. Avant les 2 semaines qui passent, on a eu 2 personnes depuis 21 mois. Alors, le nombre de cas à l'hôpital. Et puis, on voit les autres provinces qui ont aussi des grands nombres à l'hôpital. Je pense qu'on peut, dans la prochaine semaine, on va voir si ça peut égaliser un peu. Si ça peut avoir un effet que peut-être on a vu, le grand nombre, on ne sait pas encore. Alors, c'est vraiment Nouveau-Brunswick, les autres provinces, aux Atlantiques, on n'est pas toutes va retourner à l'école lundi. Alors, on regarde vraiment la même sorte de choses, l'impact, et puis c'est une question de balance qu'on a toujours. Alors, c'est une décision difficile, et même mes propres enfants, je ne sais pas s'il y en a quelques-unes qui sont les 2 qui veulent vraiment retourner, 2 qui ne veulent pas. Alors, je ne sais pas la réaction vraiment qu'ils vont avoir quand je retourne chez moi.
My next question, I'm going to ask that in English because I'm maybe going to need an answer from both language, please. I would like to understand what's your strategy about like the back to school. Like, why are you not waiting, but why are you announcing that like every Thursday? Do you think like maybe it would be possible for you to say that more in advance, to help the parents, to prepare themselves? Like maybe you can say today like no school for the next 2 or 3 weeks and avoid like to say that every Thursday, or because of the situation, it's impossible for you to plan more than a week in advance?
I don't know if it's impossible to plan. I think it's more from the perspective of that we want to be able to see as quickly as we can where we're at with our overall goal of getting our students back into in-person learning as quickly as we can. And it's, I mean, I've asked and we continue to ask, what will we see next Thursday that we haven't seen this Thursday? And, the simple answer is we have another week under our belt. We get to look at our 7-day rolling average and where we're at, and if that's stabilizing or lowering, and some of the other measures that we put in place as well. But I think that we need to, we need to continue to look at this from a health perspective and let the data guide us. But we also need to be measuring some of the other impacts as well, which is what are the overall impacts of students and families and teachers of not being in school, and when is the soonest, most possible, fastest date that we can safely begin the process to get the kids back into school and to get schools operational again. So we're trying to take this on a week-by-week basis. I mean, there certainly would be no guarantee that next Thursday we would come and say it's all systems go. We'll see what the information leads us to, but I think it's just our desire and wish to try to get our schools back operational as quick as possible when we can do it safely.
Absolutely. Alors, en français, je sais que c'est difficile pour les parents pour planifier, mais on veut, sitôt que possible, de retourner en classe. Et on veut avoir l'information. On n'a pas l'information à propos des hospitalisations, les outbreaks 2 semaines en avance. On veut regarder avec attention chaque jour ce qu'on a. Et on sait que, on vient de dire que c'est meilleur que les enfants sont en classe, mais on veut l'information vraiment pour guider cette décision et de s'assurer que tout le monde est vraiment prêt de répondre aux cas quand ils vont avoir les cas à l'école.
My last question for you both again. You said earlier both like you are watching the situations of our neighbors, especially New Brunswick. The New Brunswick is going way further than us on the restrictions. They are going to expand that. Do you think it's something like it can happen on PEI soon? I'm sure you want to avoid that, but are you thinking about that?
Well, I think we always plan for that, and we have that ability if the science in PEI and the numbers push us that way. Each province has dealt with this a little bit differently. I think in talking briefly with Premier Higgs, they have a number of challenges with their healthcare facilities in terms of staffing them in particular, but also the expectation of further hospitalizations, which is causing them to try to do everything they can to take a pause here. So we, as Dr. Morrison has said, we watch that closely. New Brunswick is a referral center for PEI patients, so that's something that we take very seriously, and we know that could have impacts to us here, Nova Scotia as well. But we really try to take all of that jurisdictional information and all of the information we have across the country and apply it here based on the numbers that we're seeing and the trends that we're seeing. So, I mean, we've also had tremendously, strict public health measures in place for quite a while, whether it's our border entry and the isolation at our borders and the reduced capacities that we have, there's really not much we're doing in PEI right now, and that's helping, we believe. I mean, the early indications would be that if our numbers are somewhat flat, maybe that is because some of the measures we put in place as quickly as we did are having an impact, and we'll continue to measure that. And if factors require us to make changes, I think we've shown in the past that we would do that, and we would do it quickly if it's required.
Oui, vraiment, même réponse en français. On a déjà les mesures qui sont assez strictes aux frontières avec capacité. Et puis, mais on regarde attentivement qu'est-ce qui arrive ailleurs. J'espère que non, on ne va pas mettre les mesures même plus restrictives parce qu'on a quand même déjà, on ne fait pas grand-chose vraiment à ce moment. Et puis, mais je pense que les insulaires ont vraiment ont toujours suivi les mesures en place et puis on demande vraiment que les insulaires continuent de les suivre pour un petit peu plus de temps et parce que ça aide toute la communauté.
We can go online now to some questions and I'm not sure who's on there, so let's start with the surprise. Go ahead.
Brittany Spencer, CBC. Hi, everyone. Thank you for taking our questions today. My first question, I'm hoping to get a little more detail about the school-based support program that's being offered. I'm wondering, is this a program that's going to be offered in schools island-wide, and what the capacity is, how many students it could accommodate, and what exactly that support is going to look like?
Does the minister or Norbert or someone want to begin, maybe?
Excuse me. Thank you for the question. And certainly we recognize these are challenging times for families, and we know that online learning is not ideal for all families. So we wanted to ensure that we were able to support those families who needed additional support on the academic side, as well maybe the social emotional support. So we'll begin that program this Monday. Parents are encouraged to reach out to their administrators. In addition, our counselors and various stakeholders within the schools will be contacting families as well that they deem to be in need potentially of these services. In terms of capacity, we'll continue to follow the guidance of Dr. Morrison and the Chief Public Health Office. Currently, we don't know, the volumes. We're not sure how many families out there would need these types of services. We wanted to make sure that they're available. So as well, we'll be expanding our respite program. Currently, there's about 340 students that are participating in that, but we will be expanding that as well. Again, recognizing that these are challenging times, we want to be there to support families, but we want to make sure it's safely done as well.
Okay, thank you. And now maybe this is a question for Dr. Morrison, but I'm wondering, as you're monitoring the situation week by week, has the province ever considered something like a hybrid model, maybe sending older students who are further along with vaccinations back first and keeping younger kids out of the classroom a little bit longer? Is that something that has been considered at all?
Hi, Brittany. All options, I think, have come up and been discussed with education as whether it's a hybrid model of when children go back, but also, or when students go back, but also what options are available for a combination of online and in-class learning. And so, there are challenges with all of them, I think. So I don't know if Minister Jameson may want to respond to that.
Well, I would I think this just might be a quick time, and maybe I can get Minister Jameson to come in as well. But as we're exploring this process, we've tried to break it down to be as simple and understandable as possible. So the direction from CPHO, the question we ask is it safe to put 19,000 students and 1,200 staff into school, knowing what we know or what we don't know? So that's always the question that's sort of percolating through Dr. Morrison's shop, and that's what they give us overall direction on. And then the department, through all of their stakeholders, are working on the operations of schools if and when that answer to that question is yes. So, I think they've explored all different options along the way and looking at what there might be available, whether it's day on, day off, or, we've talked very briefly about maybe grades 7 to 12 go back first and those types of things. But all of the stakeholders are trying to work on many of those different plans from an operational perspective. The advice from Dr. Morrison will eventually be, yes, it's safe to go back, and then education will have to operationalize that based on what we know and what we've been working on. So that's kind of where we're at. But I think all options have been and remain on the table. How we're able to deliver them, if we're able to deliver them from an operational perspective, that's what Minister Jameson and Norbert and Jills and others have been working on. But Minister, do you want to elaborate more on that?
Thanks for the question, and certainly, Premier, I think you did a great job. All options at this point are being explored. Currently, we rolled out the $125 allowance, recognizing that there are a lot of families out there whose childcare needs vary, especially during these times with online learning. And now we're expanding our respite program. We're expanding the in-class supports. So we understand that there are a number of subs out there, upwards of over 400 that are ready and willing to come to work, and we want to be there to support them. We know they are able and willing and want to support our kids. So our expansion to the support program is the next step, but certainly those hybrid models are also being explored.
Okay, thank you. And my last question, maybe this one is for Dr. Morrison, but you did mention that, once students are back in the classroom, we can expect to see cases within schools and possibly outbreaks in schools. So I'm just wondering what the response to that will look like once students go back, and sort of what plans are in place to respond to those types of situations.
So I guess a couple of things. One, I think we're trying to make sure there's measures in place to minimize how many cases and how the spread occurs within the schools. And that's why the masks and the tests and the cohorting and the emphasis on physical distancing and on screening are so key. In addition to that, of course, when there are cases identified, I know our team at the CPHO are meeting tomorrow to update our guidance around case and contact management in schools. And then we'll be also working with making sure that information is shared with all the administrators and the parents involved, so that they're aware of what happens when there is a case and what does that look like in terms of increased testing and what they have to do. There's going to always be some risk assessment involved when you look at how many students are impacted, how many grade levels are impacted, how many staff are involved. Some of those will become operational decisions as well for the schools to see if they can function if too many staff are and students are not present because they're ill. So those we'll also be we'll be changing a bit in terms of updating who is considered a close contact. So not everyone in a classroom will be considered a close contact, for instance, if there's a case, but it will be, if everyone's wearing their mask and they'll be asked to more closely monitor for symptoms and do increased testing, for instance. So there'll be more details available for administrators, staff, and for parents in the coming days. And I think it'll be a really important relationship that we'll continue to have with the schools. And we've been so fortunate to work closely with Norbert and Gilles over the last year and 21 months, 2 years in dealing with COVID in the schools. So this is not new, but we'll anticipate it will happen more, and we'll want to make sure it minimizes when children are back. We minimize the disruptions to the students, the staff, and the families involved. And that includes my own children with, with 4 of them, the chances of them and they're in different schools, they will also, I'm sure, high probability they can be impacted. So this affects all of us.
All right, thank you very much.
Thank you, Brittany.
Louise Martin, CBC.
Good afternoon to you both. My first question would be for Dr. Morrison, and I'm just wondering about modeling and how bad things could get before they get better. Our daily numbers are significantly higher per capita than many other jurisdictions now. So when you say we could hit that peak in 2 weeks, what does that mean? What does that look like in terms of cases and potential hospitalization?
Well, I think the next 1 to 2 weeks really will give us a lot more information, and I know that is being shared. That feeling is being shared by certainly my colleagues in Atlantic Canada as well. We'll have a better sense within the next 1 to 2 weeks. We actually are. We're just getting stretched a little bit, but we're trying to. We actually have numbers now in PEI that allow us to do some modeling, which we really had trouble doing before because we didn't have the numbers of cases. So we are looking in, both across the country and in the region, but even at our own numbers. So we'll hopefully be able to do a little bit more of that. Remembering that modeling has its limitations. We've talked about that before here, where it can predict what can happen, but not what will happen. And so there's those indicators that are present and then the lagging indicators, and we talked about that last time, the hospitalizations being a bit of a lagging indicator. After you have a lot of cases, it's often a couple of weeks later before you see that increase in hospitalization. So that's why we're hoping that we can have more steady number of cases and then hopefully decreasing number of cases. We are testing probably because we have different testing. We don't have just PCR tests available here. We have the ID Now machines, which is another molecular-based test, which are being used at clinics. We are probably testing more people who are symptomatic here in PEI to give us a really good picture of what's happening, and we're continuing to do that, knowing that that capacity is certainly stretched, but it will give us a better sense over time if we're able to continue to do that. Some of the other provinces aren't testing people in the same way, so that's why you'll see differences now between provinces in terms of their prevalence according to the testing.
Thanks so much for that. I'd love a response from both yourself and the Premier on this, because the Canadian Federation, I was looking at an email that was just sent out from the Canadian Federation of Nurses Unions. They're calling for governments to immediately implement circuit breakers to blunt the spread of COVID-19. It's calling the notion that Omicron is mild, it doesn't require robust action unnerving, saying the virus has potential to bring health systems to its knees. So I'd love to hear from both of you on that. And I know a lot of people are asking, and you've been asked this before, but why not just do a complete shutdown for 2 weeks to see if that would help things?
Well, I don't know why anyone would mistake our response here as thinking that this is mild or not being taken seriously. I think, we've acted in just the opposite. So I'm not sure if that's directed at PEI as opposed to maybe the actions of it focused elsewhere. But I mean, we have been really I think leading in many regards in this, because we've gone quickly and we've gone aggressively. I mean, we've had extremely strict public health protocols in place since early or mid-December, and those have been, I feel they're certainly as strict or stricter than many. They're certainly very much in line with Newfoundland and Labrador, for example, who has a similar makeup to us as an island province. And I think, I've taken all of the advice that has been given to us, our cabinet has, from the CPHO. There, as I've said many times on here, there has never been one public health directive that we've said no, and we never would. So, I mean, we continue to take that advice. We've been doing a really, really good job, and I think most islanders would be feeling that we're very much in an abbreviated lockdown, for lack of a better word, and have been for a long time. And I think that's causing a lot of the stress and concern and the tired nature of what we're dealing with here.
Yes, to be clear, this wasn't directed at PEI. This was the National Union. This is
Sure.
the Canadian Federation of Nurses Union.
Sure.
Hi, Louise. So, I feel like we have been taking robust action related to the pandemic and Omicron for a long time, and it certainly feels long for everybody. I mean, there's isolation and testing when you come to PEI at our points of entry. We have personal gathering limits. We have organized gathering limits. We have reduced capacity. We have measures for long-term care. We're delaying yet again the in-class learning for schools. We've paused all our recreational activities. So I think we've taken robust action in order that it doesn't bring our healthcare system that we all need or could potentially need to its knees. So I think that letter is probably, or email is a national one, and certainly may not identify that there are different responses going on in different provinces.
Thanks. And just one more question about this is my third, about the back to school plan. When schools do return to in-class learning, will the vaccinate or test policy for school staff still be in place? I think Minister Jameson mentioned it's 95%, so that still leaves a number of people who have not been vaccinated working within the school system. So will that vaccinate or test policy still be in place?
Yes, it will be.
Okay, thanks very much.
Thank you, Louise. And I believe that's the end of our online contribution. So I want to thank everybody. Minister Jameson and Norbert and Jills, I appreciate the efforts and keep up the good work. Dr. Morrison as well. And to all Islanders, I would say keep digging in. We really appreciate that, and stay safe.